Sorry for the last urgency. Common human disease I taught, and I told you to remember two, like bacterial disease. You remember two, that is maybe you can remember typhoid, you can remember cholera, you can remember dysentery. Viral is common cold, measles, mumps. Fungal is candidiasis and athlete's foot. And protozoan disease, African sleeping sickness, malaria, amoebiasis. And helminthic diseases, ascariasis and filariasis. Okay, let's see bacterial diseases and source. Its source. Like we have bacterial disease, sigilosis. Sigilla species cause this sigillosis. It is causing bacterial dysentery. Okay, sigillosis disease is caused by Sigilla species. You need to remember that. Okay, and its site of infection is our intestine. Obviously, bacterial dysentery it is having, like basically loose motion, which we say. And mode of transmission, food and water contaminated by feces or facial oral route. Okay, so by your if I say by your urinary tract or from your anal tract or from food and water contamination. Okay, by the faces of the affected person. Like if a vector is sitting in the stool of your and then going and sitting on someone's food, then food and water contamination is happening. If a affected person excreted its stool, not flushed rightly, and in urgency you went and sat on that without flushing nicely, then you are getting affected. What are its symptoms? Abdominal pain, dehydration, blood and mucus in the stool. So, blood in the stool, mucus in the stool, stomach ache like abdominal pain, and dehydration, also dehydration. Now, if you have bubonic plague, that is black teeth, it is caused by Yersinia pestis. Okay, just go through it. You can't remember all this. Common you try to remember, like over here two you are remembering, like if comes right, two fungal diseases you will write candidiasis and athlete's foot. If it come right, two protozoan disease you will write colors or African sleeping sickness, malaria. If it is helminthic disease, then you can write ascariasis, filariasis. Like this two you remember. Over here main you remember, like shigellosis. This is caused by Shigella species. Okay, so you need to remember that. What happens? Dysentery happens. Okay, dehydration happens, abdominal pain happens, mucus in the stool, blood in the stool, happen by food contamination or faces oral route. Okay, facial oral route. So these are the thing. Now bubonic plague, black death. It is caused by Yersinia pestis infection. Site of infection is the lymph node. Sattli vector, Xenopysla shubiosis. This is the vector. This is the type of vector which is carrying it. You have fever, swollen lymph nodes. Okay. Next we have diphtheria. We have Corynebacterium diphthery, and site larynx, skin, nasal and genital passage. Diphtheria, droplet infection, fever, sore throat, hoarseness and difficulties in breathing. And we have cholera. It is caused by Vibrio cholerae. Site of infection, intestine, contaminated food and water and facial oral route, same like sigillosis, remember. And severe diarrhea and dehydration. Now this is severe diarrhea, running to the washroom every time, and dehydration. Okay. Tetanus, lockjaw, Clostridium tetani. You know the vector very nicely. Spam of muscles. So it happens in the spam of muscles. Though through wound infection, you get a cut, you don't get the injection tetanus, then you get septic basically. Rigidity of jaw muscle, tight of jaw, increased heartbeat rate, spasms of the muscle of the jaw and face. Okay, so this all happen. Next we have typhoid. It is caused by Salmonella typhi. We know it. Site of infection is intestine, again like sigilosis and cholera, through contaminated food and water. Okay, and this is also through facial oral route also. Okay, not written but it happens. Headache, abdominal pain, discomfort, fever and diarrhea. So next we have pneumonia, streptococcus pneumoniae, we know it happens in the lungs. Breathing problem, painful fever, cough. It is droplet infection, like you give a hatcho, the sneeze, the droplet infection. The droplet goes inside someone, so use a handkerchief. Tuberculosis, Mycobacterium tuberculosis, causative agent. It happens in the lungs like pneumonia, droplet infection, thick mucopurulent nasal discharge. So thick cough from your nose basically. So just go through it once, or if you say I will go through it once more. Okay. Sigillosis caused by Sigilla, bubonic plague caused by Yersinia pestis, diphtheria caused by Corynebacterium diphtheria, cholera is caused by Vibrio cholerae tetanus, Clostridium tetani, typhoid, Salmonella typhi, pneumonia, Streptococcus pneumoniae, tuberculosis, Mycobacterium tuberculosis. Okay, this happens in intestine, sigilosis, bubonic plague, lymph nodes, diphtheria, larynx, skin, nasal and genital passage. Okay, cholera, intestine, tetanus, spasms of muscle, typhoid intestine, pneumonia and tuberculosis lungs. Okay, the lymph node disease are less important according to me. Next we have, you can remember Xenopicella chipiosis. This is bubonic plague, black death, the vector name Xenopicella chipiosis. Next we have diseases like common cold caused by rhinovirus, causative agent. Mumps caused by mumps virus, RNA virus. Measles caused by rubella virus. Viral hepatitis caused by hepatitis B virus. Chickenpox caused by DNA virus of varicella zoster virus. Poliomyelitis caused by polio virus. Dengue fever caused by dengue virus or flavivirus. Chikungunya caused by alpha virus. So over here common cold is rhinovirus, important. Mumps, important. Measles, important. Then we have site of infection, respiratory tract, mode of transmission, droplet infection, mumps, saliva and droplet infection. So these are all the viral diseases. Okay, see, common cold was inside viral disease. So these all are viral bacterial diseases and sources it is given. And this is viral. Now vector-borne disease and its causes. What are the vector-borne diseases and what are its causes? Malaria. Plasmodium falciparum causes malaria. Anopheles mosquito vector, you know. Filariasis caused by Eucheria bancrofti, you know. And Aedes species of mosquito, you know. Culex species of mosquito. Anopheles also cause. Dengue virus serotypes. Den 1, Den 2, Den 3, Den 4 and Den 5. These are the serotypes of dengue virus, and Aedes aegypti, this mosquito causes dengue. Next we have chikungunya. There's also Aedes aegypti and Aedes albopictus, same cause dengue and chikungunya, same vector. And chikungunya virus, yellow fever virus, Aedes species, Haemophilus species, Sebaceous species, Japanese JE, Culex species, Zika virus, AE aegypti, AE albopictus. Now we have Minamata disease. What is this Minamata disease? Leave all that table and all. Just we went through it. If some question comes, we can write it. Okay. This is not a biology question paper, so it will not have all this causative variant and all. But in case if it comes, we are a little bit okay with it. We can just go like MCQ. We can mark, and long question it will not come. Okay, long question. What is the disease will come? So yeah. And then we have Minamata disease. What is Minamata disease? Minamata disease, MD, is methyl mercury, MEHG poisoning. So methyl mercury, MEHG poisoning that occurred in humans who ingested fish and shellfish contaminated by MEHG, methyl mercury, discharge in wastewater from a chemical plant. Chisso Coal Limited. So remember Minamata disease, that is methyl mercury disease, MEHG. This poisoning occurred in some people due to eating the fish and shellfish contaminated by amine discharged wastewater from the chemical plant, the Chisso Coal Limited. This plant released the water which was having methyl mercury in it. Waste in the water of methyl mercury. Now the fishes were having it, that water. People had that fish, and the people got Minamata disease. It was in May 1956 that Minamata disease firstly officially discovered in Minamata city. This is called Minamata disease because it was first discovered in the Minamata city, southwest region of Japan's Kyushu Island. Okay, so in Japan's Kyushu Island, Minamata city is there, and over there it was first discovered in 1956. So these 2 points, remember that it is caused by methyl mercury MEHG food poisoning after having the fish or shellfish from the water because of the discharge of the chemical waste from Chisso Coal Limited. This company. Now, it first occurred in 1956 in Minamata City in Japan, Kyushu Island. The marine products in Minamata Bay displayed high levels of Hg contamination. So, the marine fishes which we are having from Minamata Bay, people were having there, displayed high level of mercury concentration or contamination in them. Okay. The mercury content in hair of patients, their family, and inhabitants of Shiranui Sea coastline were also detected at high levels of Hg. So the patients affected by this disease were also having high level. Typical symptoms of Minamata disease are as follows: sensory disturbances, glove and stocking type, ataxia, dysentery, constriction of visual field, auditory disturbances, tremor were also seen. So, like all this, okay, sensory disturbances, you can't sense nicely. Then auditory, visual effects, all these were happening. Further, the fetus was poisoned by MEHG when their mothers ingested contaminated marine life. So, the baby inside growing the fetus also got poisoned. The symptoms of patients are serious and extensive lesions of the brain were observed. So, extensive brain lesions were observed and the brain were observed. Okay, so failure of like brain hemorrhages and all this occurred. Fetus died after poisoning. Okay, sensory disturbances occurred, visual auditory disturbances occurred. So this was your Minamata disease. So if I say like give a summary of what is the Minamata disease, if it comes in exam, what you will write, then the answer will be Minamata disease is because of methyl mercury MEHA. I'm without seeing, I'm giving you a summary. Okay, with what you will write over there. Okay, so poisoning by consumption of the marine life, that is the fish and shellfish from the sea, where the company Chiso Limited released MEHG waste from the chemical plant into the water. As a result, the marine life had taken this water, done their respiration and other processes. So the fish got MEHG concentration. The people consuming this in 1956, Minamata disease was discovered in Minamata City, Japan, Kyushu Island. So the hairs of these people had high concentration of Hg. and they were having the following symptoms like sensory disturbances, visual and auditory disturbances. Fetus was poisoned by MEHG when the mother ingested contaminated marine life. The symptoms of the patients were serious and extensive lesions of the brain were observed. So these were what is Minamata. Now Itai disease. Itai disease was the name given to the mass cadmium poisoning of Toyama Prefecture, Japan, starting around 1912. So let's do this in the next video, okay?